Next, I will be talking about glaucoma. Glaucoma is the second most common cause of vision loss in the elderly. In the United States, it is believed to affect at least 10% of African Americans greater than 70 years of age and 2% of the Caucasian population greater than 70 years of age. However, these numbers are likely an underrepresentation of the true prevalence of glaucoma. We know that with glaucoma, early detection and treatment can help prevent blindness. So, what is glaucoma? Glaucoma is optic nerve damage associated with peripheral vision loss. Glaucoma may or may not be associated with high eye pressure. Please note that eye pressure is different from blood pressure and is checked during your routine ophthalmologic examination. So how is a person's vision with glaucoma affected? In this slide on the left, we see an image seen by a patient with normal vision. On the right, we see the same image as seen by a patient with glaucoma. In glaucoma, central vision tends to be preserved, but there is peripheral loss or constriction. In the most advanced stages of glaucoma, a patient may see only tunnel vision. This is in contrast to age-related macular degeneration, as we just discussed, in which the central vision is affected first. If glaucoma is suspected, several in-office tests are performed by your ophthalmologist. These include checking the eye pressure, which again may or may not be high, checking a visual field test, and looking at the optic nerve for damage, also called cupping. Though eye pressure may be checked in multiple ways, the gold standard is to use a device called an applanator, as we see in this photograph. The eye is first anesthetized with drops. The tip of the device touches the surface of the eye and helps to read the true pressure of the eye. It is important that a patient not squeeze his or her eyelids shut when this test is performed, and the examiner also not put pressure on the eye, which may result in a falsely elevated pressure. This slide shows a patient performing a visual field test. A visual field test is performed within a machine in which the patient's face rests on a chin rest. Within the machine, the patient is shown circles of light. When the lights are seen by the patient must respond by pressing a button. The machine then analyzes the patient's responses to determine if there is any loss of peripheral or central vision. This slide depicts the damage which may occur to the optic nerve from glaucoma. The diagram on the left depicts a normal optic nerve or optic disc, which is round with blood vessels stemming from the center. Within the center, there is a clear area, which is whitish yellow in color. This clear area is called the optic cup. The ratio of the area of this cup compared to the area of the full optic disc is called the cup-to-disc ratio. A normal cup-to-disc ratio is 0.4 or less. The diagram on the right shows an optic nerve affected by glaucoma. Here, we see that the central optic cup is significantly enlarged with a cup-to-disc ratio of approximately 0.8. This disc appearance is classic for glaucomatous changes. In addition to the cup-to-disc ratio, ophthalmologists look for other findings which may indicate glaucoma. In this image, we see a moderate-sized cup with a notch or thinning at the bottom of the optic nerve. Normally, the optic cup is usually round, so if there is an area where the cup is elongated, that may signify damage in that area. The ideal way to visualize an optic nerve is to perform a dilated examination. After dilation, the nerves may be imaged with lenses or an ophthalmoscope. This picture is depicting a direct ophthalmoscope, which the examiner is using to view the patient's optic nerve. Though there are many types of glaucoma, there are two large categories: open-angle or closed-angle glaucoma. The term angle refers to whether the drainage system of the eye is open or closed. Open-angle glaucoma is the most common type in the elderly and is usually treated with medications, whether that be drops and/or pills. Surgery may become necessary at later stages. Closed-angle glaucoma may occur with increasing age, but there is also a higher risk in Asians, females, and those who are farsighted or hyperopic. Patients with closed-angle glaucoma or those who are at risk for closed-angle glaucoma may require medications and/or laser treatment. With regards to symptoms in open-angle glaucoma, it is usually asymptomatic in the early stages. However, if undiagnosed and left untreated over many years, it can lead to blindness. The prevalence of open-angle glaucoma is related to age and increases as both men and women become older. Aside from age, another major risk factor is race. We know that patients who are of Black race have a higher prevalence of glaucoma, with the risk of blindness being 3 to 4 times greater. There is a 10% prevalence amongst those who are Black and above the age of 70, compared to a 2% prevalence amongst those who are Caucasian above the age of 70. Also, open-angle glaucoma tends to occur at an earlier age in Blacks, and it also tends to be more advanced when discovered. Other risk factors for open-angle glaucoma include positive family history and other factors such as high myopia, history of high blood pressure, cardiac disease, and diabetes. In closed-angle glaucoma, the patient groups who are at higher risk include the elderly, Eskimos, Asians, females, nearsighted patients, and those with a positive family history of closed-angle glaucoma. In closed-angle glaucoma, the risk of having an acute attack which is symptomatic is much greater than in open-angle glaucoma. Symptoms of acute closed-angle glaucoma include severe eye pain and redness, blurred vision, halos around lights, headache, nausea, and vomiting. This photograph depicts an eye with closed-angle glaucoma. Closed-angle glaucoma is considered one of the true emergencies in ophthalmology. We can see here that the entire eye is red 360 degrees, and the pupil is neither large nor small, but mid-size. If the eye pressure is high, then the patient likely has closed-angle glaucoma. The eye pressure must be reduced as soon as possible before any permanent damage affects the optic nerve. Glaucoma is usually treated with eye drops and/or pills to help lower the eye pressure. Many of these medicines can affect the autonomic nervous system and can impact blood pressure, heart rate, or the airways within the lungs. Glaucoma medicines may have numerous side effects, and these side effects may be more pronounced in the elderly, so they must be prescribed with caution. This slide depicts some of the glaucoma drops which may be used to lower eye pressure. Some patients with glaucoma may require more than one type of drop to control their eye pressure. Dosing of various drops may also vary, ranging from once a day to 4 times a day. Note that each group has a cap of a different color, which may help patients in identifying which drops they need to take and how often. In order to reduce or prevent some of the side effects of glaucoma drops, the technique shown here may be helpful. This is called punctal occlusion. After instilling a glaucoma drop, applying pressure with the fingers to the eyelids by the nose for 3 to 5 minutes will reduce absorption of the drop into the bloodstream and may help reduce some of the side effects. This slide shows some of the oral medicines used in the treatment of glaucoma. Oral medications tend to be reserved for more advanced cases of glaucoma, particularly those cases in which drops alone are not sufficient to control the disease. Each of these medications may have side effects, which a patient should discuss in detail with their treating ophthalmologist.